and ankle. So where's my action taking place? Hip, knee, ankle. There is no toe popping. Okay? So let me show you how this works. Now this is not difficult because you're actually killing two birds with one stone. Whenever I flex her leg up, I am not only doing hip action, look at my knee. I'm moving my big femur bone in my hip socket, and I'm also flexing knee. So there's two moves right there. Bam, off your list. Okay? The last move will be when I do her ankle, and you'll see how I do that. Super easy. 3 repetitions of each. Okay? Same introduction, same hand wash, same bed up, curtain around. Now look how I do this to not overexpose my patient. And this goes with anything, folks. If you're giving a partial bed bath or complete bed bath, you only expose the body part that you are washing. You don't just rip the sheet down naked. You're doing them like a car wash, and you are going to see this with poorly trained CNAs at the nursing home. You'll see them squeezing rags like this and doing all this and never rinsing the soap off. They didn't come from this college. Okay? So, now let me show you how this works. Now, you may have to reminder. So I'm only going to expose the leg that I am working with. Again, the action is going to be on hip and knee and ankle, no toes. All right? With this one, you want to support the knee joint and you want to support the foot. Okay? So I'm going flat of my hand, and I'm getting a good base of support so I don't hurt my back. And I'm going to flex her up. Now don't hyperflex her. She's young. We're all young. I mean, I can do a lot of pretty good bending. I could probably take Anaja's knee and put it clear up to her nose. But you've got to remember that you don't want to go beyond what a person, if you go too far, then you can hurt them, okay? So you would explain, you know, is it okay if I do some gentle exercises to your hip, knee, and ankle? Let me know if you have any pain, okay? So I'm cradling her heel, and I'm underneath her knee, all right? And I go and I flex up. And notice the degree here with her is 90 degrees. Do not let this happen. If you let this happen to someone that is older, you are putting so much trauma and strain on their knee, you could actually tear some very important tissues. So never do that. Okay, so you keep your flexing at 90 degrees. I don't have to push her beyond this. I don't have to go trying to get it up to her nose. Okay? All right, so let me show you the first part of this. And you can see I'm clearly exercising her knee and her hip. So we flex up, and there's count 1. And I'm rocking with this action. 2 and 3. Again, how you doing? Da, 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 da. Now, watch what I do with the ankle. You never want to go, okay, because I could do damage to her toes. You can even break somebody's toes with severe osteoarthritis. I kid you not. So I want to protect her heel from friction and shearing on the sheet. So I'm going to slide the palm of my hand underneath her heel. I am not grabbing her toes and pulling her foot up. I am taking the flat of my hand on the flat or the ball of her foot, and I'm merely going to flex her up gently and then down. So let me put that action together for you. So flex up and down is 1. Up and down is 2. Up and down is 3. So let me put this whole thing together for you now. All right.